So the first scar, this isn't my client, this is just an atrophic scar. So one of the scars, white, flat, doesn't look as though it's, it's doing anything. I would say about 60% of my clients come in with these lovely white, flat scars that show nothing at all, but they're telling me, actually, Hannah, I've got pain right underneath, but really high up. Do you think that could be related to my scar? Let's treat the scar and treat around the scar and see. So just because a client has a lovely white flat scar, you don't think anything's going on, but they're telling you they've got pain near it, let's have a look and see if the scar's impacted. This is a hypertrophic scar. So like we said, 50% of all scars become hypertrophic. You'll also notice that it's not the same all the way through the scar.
No.
So you've got raised parts, you've got flat parts, white parts, pulling parts. Now, interestingly enough, obviously I treat a lot of these scars, sometimes with silicone, sometimes manual therapy, sometimes with both, sometimes with compression, and they respond very, very well to treatment. And of course, looking around the scar as well and working around the scar. My before and after photos, this is a keloid scar. You can see it's obviously wider and thicker, and you can see obviously where the potential staples were as well. This is the scar that we were briefly touched on before.
Yeah.
You can see the skin changes, the tissue changes. It's a C-section. It's a keloid. It's raised. It's an awful scar for this lady and a really traumatic story, which I believe is all wound within the scar and how the patient moves, feels, holds themselves, X, Y, and Z. We made it like this scar, so it's barely visible, but actually look at the skin changes around it.
Yes.
So the tissue changes, the colour of the skin, perfusion of the tissues, the changes in the scar. Now, yes, did this take, I think, about 9 treatments in total, spread across about 5-6 months, maybe slightly longer actually. But look at the difference. Now, what obviously you don't see on a photo is what's going on underneath. There's changes underneath the scar, but the emotional impacts of this for this client outweighs anything that we're seeing on the screen in terms of looking.
But I guess I have to ask again. I mean, I imagine you're fairly confident that this change wouldn't have happened if you hadn't treated the scar.
Yes, and this is the thing. This is why we want to do the randomised control trial in the PhD again.
Yeah.
Because would it? Now, I don't think so, because in this case especially, the way she was moving and holding, the emotional damage of having a scar like this, and the tissues and how that was as close with her fingers she was getting to the scar and touching it, I doubt that she'd ever have made any changes. And of course, going back to the surgeon saying, I'm not happy with my scar, I doubt it would ever have got to this stage.
Well, the surgeon would almost certainly say, what do you
want
expect?
Me to do? Yes.
I had to cut and that's what happened. Yeah.
And I find it really interesting because, of course, I approach surgeons and they know about me, and I work very closely with some surgeons and they refer after their clients, and other surgeons do not want to know me at all because they think it's a slur on what they've done, that now the client needs scar therapy, and it's not that at all.